I'd be on vacation for this call. So if there's noise or if I'm slow or anything, if the Wi-Fi is weird, chat me. I'm happy to repeat myself. I've also sent this slide deck to my colleague, Tami Scott. So if things go really off the rails, she can jump in. So I'll go ahead and share my screen if that's okay. Okay, and thank you again, Bethany, for sending some questions in advance. So I'll run through these, and then Tami, please jump in if you want to expand on anything here. We may be joined by some of our colleagues from OHA as well, Shira or Alana. So if either of you are on the phone, also please feel free to jump in. I just wanted to do a quick summary before we get into the questions. So just remind folks that childcare includes care in the place of a parent for children from ages 6 weeks to 12 years old. I know it tends to be thought of as sort of a birth to 5 space, but it technically does go through age 12. I did want to remind folks that maximum groups, stable groups, cohorts, whatever term is most comfortable for you, that means that drop-in care cannot be safely operating because you can't really maintain stable groups if you have kids dropping in at all times. And just wanted to know that the new guidelines for childcare and early education that go into effect September did increase maximum group sizes to 20 for both preschool and school-age children. That does not have an impact on the ratios that have already been in place. 1 to 10 for preschool, 1 to 15 is the requirement for school age, regardless of setting. So I will jump into the question. So the first set of questions we got related to health and safety protocols. And some of these will be duplicative, so appreciate your patience. So masks being required during outside play. If children and staff cannot maintain a distance of 6 feet, then they will need to be wearing a mask. If that distance can be maintained outside, they do not need to wear masks. A question about whether that's suggested or required. It is required that children wear a mask indoors, or if 6 feet cannot be maintained, and you'll see in the subsequent answer as well, that's beginning at kindergarten and above. This does not mean when the child turns 5, you give them a cupcake and a face covering. It means if they're entering kindergarten and they're attending school age care, they would be required to wear a face covering. Why were the group sizes reduced from 30 to 20? So this guidance has been created between the Early Learning Division as well as the Oregon Health Authority. So this has really been done to help control the spread of the virus as COVID cases are on the rise in communities, declining in other spaces as well. So programs have been limited to cohorts of 10 prior to this revision that goes into effect September 1st. So we are seeing an increase from current operations, recognizing we're not back to normal, quote unquote, for school age care. We recognize, so this is a question here, that the ratio in group sizes don't make sense. So a ratio of 1 to 15, but a group size of 20 means that you can't necessarily have 20 kids in a group, which you recognize. So until the virus is better controlled in communities, again, the determination was made that smaller group sizes are critical. So the Oregon Health Authority felt that while complying with the health and safety requirements outlined in these guidelines, a group size of 20 could safely operate. They did not feel at this time that group sizes of 30 could be safely operated and not be linked to increased spread of the virus. Can a stable group be involved in a program that occurs 1 day a week over a series of weeks? Yes, they can. This does not have to be a full week. Stable cohorts can refer to a cohort a day over a series of weeks. How will after-school cohorts work? Well, they need to correspond to school cohorts. So at this time, no. We know it's not ideal that children are in multiple cohorts a day, but it's not expected that a school-age program mimic a school's stable group if schools are operating either limited in-person instruction or bringing back full in-person instruction at the start of the school year. Is the 20 cohort number as of 9/1? And if so, can more than one cohort be in a place that has enough 35 square feet of space per child. So this does go into effect September 1st. Gyms and cafeterias, other large spaces are still limited to one group of 20 regardless of the square footage available. And that, again, in consultation with the Oregon Health Authority, was recommended as you continue to learn more about the virus and how it spreads. If a program is running emergency childcare during the day and after-hour care in the afternoon, can we combine cohorts with this smaller group for the children in aftercare? So no, and this is similar to what was happening. I believe we got this question for summer camps as well. We cannot combine cohorts. If there are a subset of children that are in a program during the school day, quote unquote, and then run into an aftercare setting, they cannot be placed with another cohort of children. Any instance if or how we can have cohort groups together to provide aftercare. So again, no, when groups are smaller at the beginning and end of the day, they're not allowed to combine groups, so they must stay separate. Do all programs serving kids need to be registered emergency childcare? What is the threshold of hours or kids or anything else? So programs that do not take place of a parent's care have to be recorded with the Office of Child Care, and they can be approved as emergency child care. A program that does take the place of a parent's care must be licensed. In the interim, we may be able to get them approved as emergency child care. What qualifies as an after-school program? How many programs may a facility offer? Any hour limitations? So there's no requirements for hours or limitations on the number of programs in a facility, but there is a facility limit of 250 children or students in a building per week. An after-school program must be licensed, ECC. They must be licensed if it is taking the place of a parent's care, again with the answer above as well. So nonprofits doing a no school day style program during the day, do they need to be a recorded program? So this is, again, the kind of, you'll see this a lot in the answers. The real kind of distinguishing characteristic is if they are providing a service that takes place of a parent's care, then they have to be licensed or approved emergency child care. What
Alyssa, can I jump in real quick and just kind of add some context?
Absolutely.
You know, we're talking a lot today about programs that take the place of a parent's care, and what that is it's childcare. If children are required to show up, or not required, but they show up to your facility, they're dropped off, they're signed in, and they're expected to stay there until the authorized person comes and picks them up and takes them away for the day, that is childcare. That's a program that's taking the place of a parent's care. And you're going to see that and hear that phrase a lot as we go through these scenarios, because almost all of the scenarios that you provided were like, that's licensed childcare. You're providing childcare if you're doing these things. So I want to just talk a little bit about, you know, why is that licensing so important? You know, in the childcare field, we have worked really hard over the past decade for the recognition that the time that children spend in out-of-home care is critical to their development. Childcare licensing is recognized both at the state and national level as being critical and foundational to child health and safety. So it's not that we're just trying to be bureaucrats and say you have to be licensed. It's the foundation of what helps ensure safe places for children. It's the framework in our state and nationally that is used to protect children while they're in out-of-home care situations. And while we understand that there's a lot of really wonderful programs out there and well-intentioned individuals who may offer a really safe environment without the structure that licensing provides, it's just not true of everyone. And it's always shocking to me when people start working for the Office of Child Care, they're so surprised at all the things that are actually happening out there. And so that's why the state has standards and requires licensing. So for any programs that are conducting childcare, licensing is not optional. It's required by law. So you're going to hear Alyssa and me say the same thing. If you're caring for children and you're taking the place of the parent's care, you are required to be licensed or approved as an emergency child care. And so if you're conducting that sort of service, you do have to register as an emergency child care. You have to follow all of the guidance put forth by the ELD on the August 14th and have your staff approved through the emergency background check system. If you intend to continue beyond a temporary basis to continue to provide this sort of service, service, you have to get licensed. The emergency childcare approval was really meant for a very short-term temporary solution for a pandemic that started in March, and we did not imagine that come end of summer we'd still be sitting here. So because it's carrying on much longer than anticipated, licensing is going to be required. The emergency childcare is a temporary fix, but it's not going to be a long-term fix. So as you're thinking about your program and evaluate your program, if you're taking the place of a parent's care and children are required to stay until somebody comes and picks them up, that's childcare, and you do need to start in the process very quickly to get going.
Thanks for clarification. I just wanted to call out a number of questions that have been posed and that you may actually address in the further slides. Is the clarification between what would be camp during the summer and those extending their care, or things that operate really as a normal club or class? So karate class, does that need to be a emergency child care in this?
Yeah, so there are different exemptions that are not considered childcare. So a single enrichment activity where children are on site less than 8 hours a week is karate class. You go to karate class twice a week for an hour, that's not childcare. That's a single activity that you're doing for only a couple hours a week, and that is not childcare. And in terms of the summer camps, I'm not super clear on the question there, but there isn't a camp protocol set up for during the school year. Summer camps are a very specific summertime activity during the school year. If children are dropped off and expected to stay, that's childcare and needs to be licensed.
And I think it is the fact that it's so many days out of the year, perhaps. I know many of our Boys and Girls Clubs run recorded programs, but then they offer camp during the summer, which is very different. To have people signed in for a full day, that would be more than that 8 hours. And there's also a number of other exemptions, I think, that are questioned here around a Parks and Rec or municipality offering, and those are not required to be licensed.
Right. Thank you for bringing that up. Programs that are run by another governmental agency, usually the city and the Parks and Rec department, those are not required to be licensed or approved as an emergency childcare because they have another governmental entity that is overseeing them. So thank you for asking that.
But they would be required to follow the guidance that's being put forward if they're caring for kids up to age 12. And that's the same for schools as well, which would be another government entity that falls into the exemption space.
Okay, go ahead, Alyssa. I gave my little spiel. If you want to go, keep going.
Yeah, so please jump in again, Tami. So as I mentioned, schools and aftercare programs. So repeating, if a program is taking the place of childcare, they must be licensed or approved ECC, regardless of if that's indoor, if that's outdoor. Programs run by a school. So if it's run by the school, it has to follow the ELD guidelines, but licensing or approval as an ECC is not required. Programs that are run in a school, so if a school is partnering with a Champions or a KinderCare or a YMCA to provide the care on school grounds, that program must be licensed or approved emergency childcare as well as following the guidelines. Will the new health and safety guidelines released on the 14th effectively replace the summertime day camp guidance? So we are in the process of reviewing the camp guidance alongside the childcare guidance, alongside the Ready School Safe Learner guidance. So we'll have additional information. But as Tami said, if you're caring for kids up to age 12 and summer is over and we're now in the space of, again, you're taking the place of a parent's care, that is going to be childcare. If you're caring for a child over the age of 12, that's really what we're looking at with the Department of Education, Early Learning Division, and Oregon Health Authority to make sure that there's clear guidance and expectations for those programs. Will there be separate guidance coming out from OHA that is relevant to non-licensed youth programs? So again, a youth program must be licensed if they're taking the place of a parent's care and caring for children up to age 12. If this is in reference to programs for maybe providing spaces, say for high school age children, then that is what we're in conversations with the Health Authority, Department of Education, and Early Learning Division about, to make sure that we're both consistent and, most importantly, taking a really strong health and safety stance as we look at these settings. So, and this question came up, do city-run after-school, out-of-school programs have to be licensed? So if the city is running the program, it is exempt, or if the county is running the program, it is exempt from licensing, but they, again, have to follow these guidelines of caring for children up to age 12. Do the new registered childcare guidelines apply to non-licensed day camps? So again, all programs taking the place of a parent's care have to be licensed or approved ECC. If we're talking about programs caring for kids over the age of 12, then we will be providing additional information in the coming weeks. Will there be day camp guidelines that would allow after-school programs to operate regardless of phases? At this point, we are not looking at anything that is tied to phases for camps. We are looking, again, this would be specifically for children over the age of 12, otherwise following the ELD guidelines and being licensed or an approved emergency childcare program. This will also apply for guidelines for out-of-school enrichment programs. As Tami said, there are some exemptions, like 8 hours in the week. So if this is, an hour a day, that's not going to meet that 8-hour threshold in a week. And would be exempt. Otherwise, if it's more than 8 hours in that week, then it would need to be licensed or approved emergency childcare.
Well, and let me add to that too, that 8 hours is only for a single enrichment activity. Yep. So you're doing ballet class, you're doing computer class, that's fine. But if you are doing a activity that involves snack and homework and playing baseball, where you're mixing multiple things, that doesn't fall under that exemption. That's childcare.
Thanks, Tami.
You're going to hear that a lot. Nope, that's childcare. Sorry.
Is there special outdoor programming or outdoor schools guidance? So at this time, no. We have been in conversations with the OSU Extension Program and an outdoor school to determine how they may be able to support K-12 specifically, but at this time, there is no special guidance for that program operation. How many hours and what hours each day can recorded programs operate without becoming an emergency childcare licensed childcare facility? So, and Tami, jump in here too, recorded programs, whether they're school age or preschool recorded, must be approved emergency childcare. While there is no limitation on school age hours, there is on preschool, but a school age recorded program does not take the place of a parent's care. It also cannot operate during the hours that school is in session. And I think the real kind of thread here, as I mentioned in the first slide, is it cannot be drop-in. So kids can't be able to come and go as they please unless you're saying these 20 kids can come and go from this classroom, this single program. And Tami, if there's anything you want to add to that.
Yeah, I do. I want to talk a little bit about the cannot operate during the hours that school's in session, because I do have to confess that I have provided some incorrect information. And so I imagine some of you have asked this question before, so I just need to clear it up for everybody. So when we're talking about hours that school is not in session, the question has come up when children are doing distance learning, where they have a set time for their distance learning with their school. Is school in session or is school not in session? And I had previously provided guidance to some of my colleagues at the ELD that school is not in session when they're doing distance learning, but I have to correct that. And I sure apologize if you were one of the people that received that information from my ELD colleagues. That was on me, not on them. But we have determined that if children are doing distance learning, so, their classroom is meeting from 9 a.m. to 1 p.m. Distance, that is considered schools in session, which would mean that a recorded school age program could not operate during those hours. So I know I've heard of, for example, Boys and Girls Clubs wanting to pull kids in during those hours to support them with their distance learning, maybe support them with their internet. And it would be considered schools in session, which would then bump it over to being childcare, which would then bump it over to requiring an emergency childcare approval and or a licensed down the road if this is going to continue to go on. So again, I'm happy that I have this venue today to clear that up and take responsibility for it, and apologize if you were told something different.
Sorry, I just wanted to catch on one of the things you said there was if they do need to register as emergency childcare and then may possibly need to be licensed down the road, but is the understanding that registering as emergency childcare currently would kind of cover your bases?
It does right now, but that's kind of what I talked about a little bit ago, is that emergency childcare was never meant to be a permanent thing. We did not imagine that we would get to August and still have this going on. So it was really developed for a very short-term situation. So if you're the service that you're, and now we know it's not ending. And so now we know with it not ending that our emergency childcare solution that we began in March and April is not something that is going to continue on infinitely. And so if, like I talked about earlier, if this is a service that you plan on operating more than just a couple months, while we're in this pandemic, you are going to have to move to licensing. It's not going to be that you can be emergency childcare for the entire next school year.
But, and thank you for clarifying. There was a question on if programs, so as of September 1st, they should apply for emergency childcare if they are planning to operate within that threshold, which is a fairly low threshold we're finding for childcare, then they should right now start the process to become emergency childcare. But that would, for the time that we are in emergency, which is the foreseeable future till there's a cure, a vaccine, they would then be within a system that they'd be following guidelines.
It will for right now, but what I'm expecting to see that's going to come out in the next temporary order is that there's going to be given a timeline for moving into license, because essentially you're doing childcare. And like we talked about, childcare is the foundation for children being in a healthy and safe environment. And it was never meant that temporary emergency childcare would go on as long as it had. And licensing is the foundation. So I'm expecting in the new temporary order that it's going to be put a time frame on it of when you have to move into licensing.
Tami, will there be anything, so it sounds like a program, if they're not already emergency childcare, they should start that process ASAP. And then will there be anything kind of on ELD or OCC's end to say, great, you're ECC, here's what you've got to do next to get fully licensed?
Yeah, absolutely. Our licensing specialists, that's what they do day in and day out. So you can right now go on to our website and click on the emergency childcare tab within the COVID-19 section. And there's a toolkit that'll get you started with becoming the unlicensed emergency childcare. And then once you get that process going, our licensors will absolutely support every step of the process to become fully licensed.
And that is an open process currently. It's been reopened to allow ECC. Yes. Is there necessary to provide documentation that there's a need or any of those pieces?
What I can tell you is I know Miriam and Alyssa have been working on what does it mean to right now. The requirement is still that you have to demonstrate community need. If children aren't in school, we know there's a community need, right? So I don't think that that's going to be very much of a barrier.
So does that mean that you're going to be looking at the child care rules and addressing the issues that surround school age programs?
Beth, I'd have to, the rules are what they are, and there's no adjustments that can be made to the rules right now. But, we do have many, many licensed school age programs that are able to successfully operate within those rules. I know that they need adjusted. I know that they need updated. You and I have been on work groups where we've attempted to get that done. I know.
For years.
I know. We go way back on this project, and I promise you that it is as much a passion of mine as it is of yours, because I definitely do understand that there are some barriers there. But the rules will not be changing anytime soon.
Okay, that's an issue, but we'll just
I know it is.
That.
Yep, I don't disagree with you one bit.
Sorry, I'm just about to give it back to you, but I did have a question come in that I wanted to address on the timeline. And so the new guidance for childcare and early education goes into effect September 1st. Is the expectation that programs would not be able to operate without an approved ECC as of September 1st? Or if they have started the process, can they continue to operate, or can they operate?
Yeah, I would say what we need you to do is start the process now, get your application submitted, and start going through the checklist and the guidelines and making all the adjustments that you need. And then we're going to be working on our end what that implementation looks like. Because we recognize that there's going to be a big need in 3 to 4 weeks with school starting. And so we are going to do what we can to be flexible and support families and support programs to continue to provide a space for children. So go in, look at the application, start making the adjustments that you need, reach out to us and we'll support you through it, get your application submitted, and then we'll work through that process with you.
I would just add to, we're not trying to disrupt services to kids and families. So, and I know Amy Joyce has talked about this as well. She's also on vacation, which is why we have Tami joining us. And I think, if you're a Boys and Girls Club, for example, who's not an emergency childcare facility, you've been running a summer camp. I think it's fair to assume that there is somebody who runs that program that would be considered an expert in school age care. So they would likely, and Tami, correct me if I'm wrong, that likely would be enough to basically say you can continue operating until your ECC approval comes through.
Yes, I would agree. I was talking to Miriam about this very thing today because we know we're going to have a backlog, and it is not our intention, like Alyssa said, to make it difficult or make it so that children don't have a place to go, because we recognize that parents are scrambling. And while I can't give you an exact definitive answer today, I'm confident that we'll make it all work so that children have good places to go, as long as you're doing your part and moving through the process.
I'll keep going, and Bethany or Tami, please interrupt. I think we're on this third bullet. So is a recorded site like Boys and Girls Club, do they have to be licensed? So repeating the mantra, if they're taking the place of a parent's care, they must be licensed or approved emergency child care. Can licensed and recorded school-age out-of-school time programs run by CBOs use the Ready School Safe Learners Guidance as official guidance rather than ELD? So no, the Ready School Safe Learners Guidance was created for school and school district use. It is not able to be modified for CBOs, and it is not for licensed childcare or recorded programs to use at this time. Well, the Office of Child Care provides support for funding for the increased number in teachers, as well as fewer children per class as required during COVID times. So some of you have maybe heard me talk about this before, but we asked Oregon State University to estimate, when this first happened in March, what the cost would be to support providers under the emergency child care requirement. So with the reduced cohorts of 10 at the time, as well as the increased sanitization requirements, everything's come into place. So they found it would take $80 to $90 million to cover the cost for just 2 months. So unfortunately, we have not gotten anywhere near the resources needed to be able to offset this financial burden. So without increased federal support, we currently don't have the ability to provide funding to help with these changes in operating costs. And we fully recognize that there is a major financial impact to operating programs in this way. Similar to this next question, any funding available to support out-of-school programming? So no additional grant programs are currently planned for the fall, but if we do receive increased federal funds for childcare, as we did in the spring, then we will be looking at how we can support out-of-school programming and other programs caring for school-age children with those resources. Who will provide COVID safety trainings for childcare workers? What about trauma-informed care, anti-racist training? So the Governor's Healthy Early Learners Council will be working on training recommendations for the governor, as well as for the early learning division to consider. And Bethany, feel free to jump in here as a member of that council. But we're already starting to hear from the providers on that council, from the parents on that council, from pediatricians on that council, just the need to be offering additional training, have it created within an equity lens, and pushing anti-racist trainings as well. So that's still being discussed. The governor does listen to join those meetings, and I check in with her when she's not able to join for the full time. So we are working on what we can be doing to better support providers in that space. And Bethany, if there's anything you'd like to add there, I welcome your input as well.
I would just add, I think part of this was not only as far as capacity for providing it, but capacity for being able to take it in and fund that. And so knowing that there are so many people working really hard to share information, but it's just not adequately meeting the need right now. And so I think recognition that there's going to need to be far more coordination and support for ensuring that people have adequate access to what that comes up with. It's just as an extra emphasis and note, I think.
Yep. Thanks, Bethany. Overlapping guidance. So we had a question about the actual start date for Preschool Promise program specifically. So grant agreements for all phase 1 grantees will be going out by August 31st, so Monday. There'll be additional information for programs that need flexibility to start due to COVID-19. So we're trying to both allow the Preschool Promise programs, particularly if they're a previous grantee, if they're ready to hit the ground running, giving them the flexibility to do that, but also allowing our newer grantees or our smaller grantees who maybe can't be as ready to have some flexibility to get going. So grant agreements should be out the door by Monday, and you'll get additional information then. Will the emergency childcare order stand for the foreseeable future? Yes, as Tami said, that was never the vision when this first happened, but it's, I think, become clear to all of us that there will be some version of emergency childcare and this structure in place for a while. Will ODE allow programs to operate in school buildings? So that is a choice of the individual school district if they would allow programs to operate at schools. So ODE doesn't have, the Department of Education does not have anything that prevents that from happening. That would be a local school district decision and a local facility decision. Can childcare programs operate in school district facilities under the childcare guidelines? So yes, school-based childcare programs must follow the childcare guidelines regardless of licensing. So that would be regardless of whether it's being run by the school, so it's technically license exempt, or whether it's being run by a Champions or a YMCA on the school premises and must be licensed, or emergency childcare. How can daycare preschool centers function inside a K-12 building? Which rules or guidelines need to be used? So all guidelines apply regardless of location. So these programs need to be following the childcare and early education guidelines. And I would say something that overlaps between the Ready School Safe Learners guidance and the childcare and early education guidelines is this 250 facility limit. So this is about the number of children or students that are in a building over the course of a week. And so if a school is allowing childcare or preschool to operate in a school, they're still beholden to that 250 child limit within the course of a week. And that's all the questions we got. So happy to answer additional ones. I have not been watching the chat, Bethany, so totally defer to you on those.
Probably better that you haven't. We've got quite a few that have come in, but I think I want to circle back. There's a couple that came up really quickly that I think are really good, or recently that came up I think are good questions. So Matt had asked if a public agency is contracting with an independent contract to provide any part of a program or service, would that contractor need to be licensed or ECC?
Tami, you're muted.
Yeah, still muted, Tami.
Oh, okay, can you hear me now? Okay,
yes.
Sorry about that. I can't even find my unmute button. Okay, that's the exact scenario that happens in most after-school programs where the school has the YMCA come in. They have Salem Child Development. They have Champions come in, and those programs are required to be licensed because the school is not the entity running the program.
And then I had several other exemption questions. One particularly around younger preschool age kids and the less than 8 hours. Does that as well fall within an exemption? If it's less than 8 hours in a single activity, then they also do not have to be childcare.
Yeah, the exemption around the less than 8 hours, I believe, is specific to school-age children, but I'm going to look at it so that I don't misstate it. It says provide care for school-age children that is primarily a single enrichment activity for 8 hours or less. So that is specific to school-age children. It's not referencing preschoolers. But a preschooler who goes to swim class it's not childcare. And I think usually what happens with preschoolers going to those sorts of programs, their parents usually stay on site also. When the preschooler goes to gymnastics or goes swimming, the parent typically stays there with them. So that might be why the distinction is there.
And then we've had a couple questions come up around the term in school hours. So how would that be determined for kids who are enrolled as homeschool students? And learning pods and online academies, and where do we have any clarity on that one?
I mean, I'm not sure what the question is. It as it relates to how a recorded school age program is allowed to operate. I think I would need more context.
Matt Bradley, did you want to unmute and ask your question in particular?
Sure thing. Can you hear me?
Mm-hmm.
Awesome. But yeah, thank you for taking the question. I just, I'm still kind of processing this stuff, but it's my understanding that like school age recorded programs or there's some sort of rule in there that affects like programs operating during instructional hours. In other words, during hours that students should be in school, and how that affects the level at which you're required to have your program licensed, whether that's a recorded program or whether that's a licensed childcare, or whether it's like a single subject, less than 8 hours a week activity. But it was my understanding that there's some sort of restriction in there in terms of operating during instructional hours. So that's obviously pretty straightforward if students are enrolled in person going to school. But if they are only learning online, and if a large portion of that learning is asynchronous, or if they're enrolled as homeschool students, how would that impact that designation?
Yeah, and Alyssa, jump in if you have anything to add. When I think about the requirement that a recorded school age program operate during the hours school is not in session, I would say that is referring to a normal public school schedule. Monday through Friday, and where the school takes off the summers and the school takes off the holidays and Christmas break. So I don't see that somebody who's homeschooled, that would have any effect on the hours that school are in session. I would say it's the normal school hours that a typical child is in school.
Thanks. And then I think somewhat related to that is the combination of emergency childcare and limited in person. And so there's been numerous questions come up about combining those and being able to offer both. Are a little more information or clarity or discussion?
Yeah, so I flagged this for the Department of Education and forgot that I can't access my work email without my phone because of dual factor authentication. So I don't know if they responded, and if they have, I will send it to you, Bethany, when I get back. But I would say in the little bit of conversation I've had, kind of not this exact question has come up, but something similar. So the limited in-person instruction is limited to 2 hours, cohorts of 10, again, with that 250 facility limit over the course of the week. So it's my understanding that if you have school-age children who are there for the day, let's say from 8 a.m. to 3 p.m. or 5 p.m. and 2 hours of that they'll be in limited in-person instruction. That's the scenario that I've posed to the Department of Education. And my understanding is that may be allowable. You're still held to that 250 child facility limit. I think the part that we're working through with the Department of Education is that cohort piece. So the limited in-person instruction is limited to 2 cohorts, including transportation. It does not include childcare. But if it's the same children in the space, that's just the part I would like to understand the nuance of how the Department of Education would like to see that safely operate, again, with public health and safety in mind.
Thanks. And then I wanted to circle back to the timeline. And so you recognize that as of 9/1, the new guidance will be for all childcare and early education. Will summer camps that are still going through just September, but they're actually just planning to be a summer camp because school is not starting yet, do they need to apply for ECC to finish their summer camp calendar? Or because there was recognition and note along the way that this camp guidance would be in effect until otherwise noted. So is there a need for them to finish the camp season as an ECC, or can they finish as a camp?
Yeah, and Tami, jump in. So if the normal season, I think that would be the first question, is this sort of their normal season, or have they created an expanded season because of what's happening with comprehensive distance learning in most of our districts? But my guess would be, just with the timing and because there is no end date placed in the summer camp guidance, there wouldn't be an expectation that they have to drop everything and switch right away. I would say it would be preferable that they switch to emergency childcare, but I don't know, Tami, with the backlog, if it makes sense to go through that process if they'll be ending in a couple of weeks.
Yeah, I mean, it really wouldn't have occurred to me that a summer camp would go past the beginning of September.
Mm-hmm.
So I would go along with your answer, Alyssa, since, if there's only a few days that you're just finishing up your program, it wouldn't make sense to me if you were not going to be continuing.
And Jake, does that answer your question?
Yes, I think a lot of districts are doing comprehensive distance learning till like September 8th or starting on September 8th or September 14th. So just wondering for that week or two stopgap, if we're actually honoring when the school district is going to start their comprehensive distance learning in the first 2 weeks of September, if we could just continue on the guidance we've been on for 13 weeks or whatever it's been.
Yeah, I will follow up, unless Shira or Alana, if you're on the line and want to jump in, I will follow back up with the Oregon Health Authority. It sounds like that's an example of kind of expanding the season, but again, regardless, we don't want to see a disruption in services. So we can talk more, Tami, I think, about whether if it's until September 14th with sort of the process of ECC, would that be turned around in time? I think regardless, we wouldn't want this to prevent the program from operating. If you want to add anything there, Tami.
Yeah, no, I agree with you, Alyssa. I guess, none of us knew that school was going to be so delayed in starting this year. So that just would feel a little bit red tape-ish to me if you had to do it just for 2 weeks of operating.
Thank you. And then there was just clarification on exemptions. And so I know we're going to try and do that. And Katie, if you go to the next slide, there's actually I tried to capture a statement to see if there was some way we could help programs figure out if they would be an exemption or if they do need to go through ECC. If there was the last statement here, so many hours, sounds like that 8 hours per week in a specific enrichment or a number of kids. So if there's small private schools that are on the call and asking about if we have so many kids, so many hours per day, can we operate as a school still, or do we need to be childcare? And ages, we've clarified it's only up till 12.
Mm-hmm.
Well, and on our website, we have documents that list out what makes you exempt from childcare. And the only thing that has to do with the number of children that you care for is if you're caring for 3 or fewer children, you're exempt from childcare. And then in terms of if you're a small school, that falls under ODE and the Ready School Safe Learners guidance. That would not fall under the childcare guidance if you're trying to do schooling with children.
I would also note,
in a private school scenario.
Yeah, and this second kind of section, it is a 20 group, max group for phase 1 and phase 2. There is no allowance for groups of 30. regardless of the county phase.
That's not changing.
As of right now, no. From a public health and safety perspective, the Oregon Health Authority is not comfortable with groups of 30 children. And I think by comparison, limited in-person instruction is limited to cohorts of 10.
Mm-hmm.
And I really just want to really put a underline on the less than 8 hours a week is only for single enrichment activities. That is not for childcare.
And then can early emergency childcare receive ERDC? Is there clarification from ODHS on that?
Yeah, if they are approved emergency childcare with Office of Childcare, I do believe that they're qualifying for ERDC reimbursements if they pass the listing process.
And I would say if anybody, Bethany, if anyone contacts you and they're having difficulty with that, let me know, and I'm happy to work with DHS on that.
Great, thank you. So I think we did clarify max groups is 20 at this point in time. There is no 30. It is up to 12-year-olds. If you are in any school building, you would have to follow the guidelines, whether you're provided by the school or not. I just, to that statement there, with Parks and Rec or other government agencies that are not, they do not have to be licensed or recorded, but is there an expectation that they are following these guidelines?
Yeah. So, I mean, again, this, as Tami said, these guidelines aren't there to make things harder. It's about public health and safety. And I think, and that's why the Oregon Health Authority really helped create these. So, if you are license exempt because you're a government entity or a school, these programs, you still need to be following childcare and early education guidelines when you're caring for kids up to age 12. Just because you're a Parks and Rec doesn't mean we want 40 kids in a classroom, right? It's both not fair to the Boys and Girls Clubs in the room, as well as not safe and can increase risk of spread. So that's the expectation for any program that's exempt from licensure because they're a government entity or school. And I would add too, on the group sizes, I don't believe I think Umatilla finally moved out, but if a county does go back into baseline, then that cohort of 10 and essential workers kind of provision kicks in, but we're really hoping that doesn't happen again. But I did just want to note that, regardless of age.
I was on the optimistic train. We didn't even have to go there, We're
Yes,
all going down.
Numbers are going down.
Yeah, so the next slide has a couple of queries I wanted to make sure that we note on, particular the childcare guidance is up to 12. And so older youth, and it was brought to my attention, middle school actually includes 11 and 12-year-olds frequently. But if you're offering programs for older youth, is there other guidance for people to be following? Or is the expectation you're still following?
That's what we're working through with the Oregon Health Authority is as we look to the summer camp guidance that was in place, as we look at Ready School Safe Learners and the child care and early ed guidance, how do we make it aligned, again, with public health and safety in mind, and find a place to direct folks? So we have some meetings. I know some meetings are being scheduled while I'm out this week. We have some conversations next week. So our goal is to have either FAQs, if not clearer guidance out by the end of next week, ideally.
Thank you. So that's to the timeline is good to know. And what is the best way, this came up a couple of times, what's the best way for people to get the right information around where they fall and what they need to abide by? Is because I don't know if you want 500 emails a day of, is this me? Do I qualify? So where's the best place for them to go to make sure they're getting it up to date?
Yeah, unless Alyssa is going to offer up herself and her services, I would imagine the best option is to call the Office of Child Care at 1-800-556-6616, and we will get you connected with a licensing specialist who can talk you through it.
And then is there other recommendations on the best place? I know this actually came up during our Healthy Early Learners Council on where is updated information for programs, parents, partners, is it going to be through the ELD, through the governor's website, through OHA, and do they all align?
Yeah, so as Tami mentioned, the Child Care and Early Education Guidance is on the Early Learning Division's website under that COVID-19 header. The Ready Schools, Safe Learners guidance is on the Department of Education's website. But all of the guidance, camp included, and if we do come up with something for kids over the age of 12, that everything lives on OHA's website, which you can either get to from OHA's main page or from the governor's office's main page. So if you so your one-stop shop, your best bet is that COVID-19 landing page that you get to through OHA and through the governor's office.
And then there's a couple more questions that have come up right here at the end. Is it realistic for people to expect to get someone on the phone, a licensure? There have been a number of people have noted it's taken a while to get in touch with theirs. Is that the best way?
Yeah.
And is there, go ahead.
And we have a standard that our staff need to return phone calls within 48 hours. I'm sure you can imagine that with the August 14th guidance coming out, that they are inundated with phone calls. Another method that you can use is we have an email, and let me pull it up to make sure I don't give you the wrong email address. And I believe it's provider contact. Yes, it's provider contact, all one word, at ode.state.or.us. And that goes to, actually, it goes out to our manager in LeGrand who monitors that one. And I will give her a heads up that she might get flooded. And then she can kind of get it outsourced to the right person. So, I mean, if you're hearing that, if you're not getting a call back, I think I would go ahead and use that. We do definitely want to support people and return those phone calls. And I also, I know that our licensors it's a very, very busy time. And I am putting the email in the comment box because I saw the request to do that. The other thing that happens about fall is that, as you can imagine, through the course of time, many programs have gotten licensed in fall. So we have what's called fall rush, which we literally renew about 30% of programs in a 2-month time period. So it's a crazy time.
And we still have COVID-19, so
that's true. It's an extra crazy time right now.
And then there's a couple of specific questions on like hours and limits, and I just wanted to note, because I'm wondering how cumbersome is the process to be ECC, and then we've had programs that have said, but this is something very unusual, right? They're responding to the need, and they don't want to be put in a box where then they're expected to become a licensed childcare center, because that's not their long-term goal. It's just responding to the need. So is there that we can waive the worry that if you become an ECC, you'll be expected to be licensed someday? Or is that?
I can't waive that worry because the fact is that like I said, when we designed this in March and April, we really did think it was just a Band-Aid on a temporary situation. And because the situation is going on much longer now, we have to look at and realize that there was never an intention for emergency childcare for people to operate under those very limited guidelines and very limited oversight for as long as it's happening, and what really could be the entire school year. If we're being honest, we don't really know what's going to happen with the disease, but we know that it's still on the rise in Oregon. And because we talk about that licensing is the foundation to keeping children safe and healthy, it really is in the best interest of children that programs are moving in that direction. And I know that that's not necessarily what everyone wants to hear me say, but there wasn't an intention that emergency childcare would go on for months and months and months on. And unfortunately, that's the situation that we're in Oregon. And Alyssa, I don't know if you have anything to add to that.
No, I think just that we're trying to make it as painless as possible. But again, it comes back. It's not red tape for the sake of red tape, and it is about that health and safety. It's about that level of background check. It's about the fact that we have kids and adults with unsupervised access to children, right? Like that's why we have government entity exemptions. That's why we have school exemptions, because there's existing requirements in place that can substitute for licensing requirements. And so I think the best we can offer is just, that the Office of Child Care is there to help folks through that process, but that this is in an effort to keep health and safety in place, both in light of COVID and just in terms of who's watching our kids all day long.
Thanks. I want to note, I know Alyssa joining us on your vacation. Thank you. Said we would only take up an hour of your time, but we're going to keep going with questions. Is there anyone that feels the need to yell out your question at Alyssa before she logs off to make sure we get a response? You're welcome to unmute yourself and do so. And if not, thank you, Alyssa. Tami, I don't know if you're able to stay on. There's definitely some more questions that look like are right up the licensure avenue. Particularly, and there's one on when is health and safety plan template expected. I know that came out that there will be documents supporting.
Yeah, and I can answer that one super fast, actually. The template is very much like 99% drafted, doing some final touches on it this week, and then getting it through the translation process, because we have just a real commitment to equity, and we want those things available in all languages at the same time so that everybody has the same level of access. We're also working on a whole library of tools actually to support with the implementation of the guidelines. We're working on transportation templates, communication with parents, how to help children wear masks. I mean, a whole library of things that I would expect to be seen on our website in the next couple of weeks. The template, I would probably say a week and a half would be my best guess, because we do need to get through the translation process.
Thanks. And then there's a question around meals. And so will there be additional resources or guidance or help to help ECC facilities have access to meals that they serve? So just kind of like there was normally during the summer, there's summer meal sites. Any information? And I know we had someone from Child Nutrition signed up to join us, and I don't know if they might have another answer for us, or if Alyssa, you know of anything, or Tami.
Yeah, I that is not my realm.
Yeah, no, if we've got some from Child Nutrition, otherwise I'm happy to follow up on what kind of supports we can help put in place for those programs.
I think I would like to asterisk and star that if possible, because
Yep.
I know that the normal summer meal site access and the fact that programs are going to be increasing the number of hours and the number of kids they have in their facility, and not normally providing meals is going to be a huge issue, I think, for many families who, and will they have access to district provided meals if they are doing distance supports?
And there is a federal waiver, Alyssa,
Mm-hmm.
for food that ODE Child Nutrition just got.
Yep.
And lots of discussion about pandemic EBT. So.
Yeah, I know that I do know that there are districts that are continuing those services. So I'm happy to follow up with Child Nutrition staff and sort of see if we can get some concrete responses out. Back to you, Bethany, to share with the group.
Thank you. I had a question around circling back to Preschool Promise, and is there additional licensure or paperwork that a Preschool Promise applicant would need in order to operate normally this fall?
I'm happy to take a pass at that. So I know that what is going out starting Monday is the grant agreement, and I believe some additional, the updated program manual should be released as well, in terms of what the kind of program operation expectations are for providers. So if you're a new Preschool Promise provider, you can reach out to the Preschool Promise team at the Early Learning Division, and I'm happy to follow up with an email address to give to Bethany to send out. But that program guidance and manual should be going out next week as well.
You know, and then a question around the number of hours. So to the exemptions on 8 hours of single activities, or single enrichment. If a program offers multiple of those for children to come in and out of, if a child happens to go over 8 hours, does the program itself have to be ECC?
Yeah, so that exemption is for children not going over 8 hours. And so they would have to ensure that children were not there for more than 8 hours in the week. And if they are there more than 8 hours, then you're crossing the line into childcare.
Thank you.
And so there is a question here from Sinu about children with special needs. It just came in. I think that is a huge issue that needs to be addressed. So she says, how can we support providers who do not have credentials in special education to meet the needs of students on IEPs, IFSPs? How do we support our families in this area as well? Most importantly, how do we plan to support the children who are needing extra special education supports?
Yeah, so I'm happy to follow up with the early intervention, early childhood special education team at the Oregon Department of Education. They have been working on guidance based on sort of building off of both the Ready School Safe Learners and the Child Care and Early Education guidance for their contractors. So happy to share that thinking. We are also in conversations with the Governor's Early Learners Council, as well as just generally, I think, across the board with how we're supporting programs to sort of best meet the needs of children in their care, whether that's children with special needs, children with behaviors as a result of COVID-19, and getting those services and supports out, and how we can also bring, if early intervention, early childhood special education services are needed, making sure that children still have access to those through COVID. So I'm happy to follow up with information from their team at ODE and at least an update on when their guidance should be going out if it hasn't already.
Well, and I think that's an interesting question because it's not just about the early intervention services, because it's about the children that are in school, that are school age and normally receiving those services. And I mean, I actually feel like that's more a question for ODE than it is for childcare licensing. I don't think that that's our realm of expertise by any stretch.
Yep. Thanks, Tammy. Yeah, and I'll absolutely flag that for Colton Scott at ODE as well, and share any information they have, or make sure we can get somebody invited to the next discussion from their team.
And I had a very specific question, Juliet. I don't know if you are still on and wanted to ask your question around emergency child. If you've applied for emergency child care, but your other licensing hasn't come through, is there a reimbursement process that needs to happen in order to get ERDC or DHS? And I don't know, Juliet, if you're on and want to.
Yeah, I'm on. My question was, if you're operating as emergency childcare and during that period you've not been processed for your family childcare license, when you finally get it, are you supposed to be reimbursed for what you have worked for since Office of Childcare approved you to be emergency care?
I'm sorry, I just cannot hear the question. I'm so sorry.
I think it's around, if you've been offering emergency childcare, can you get reimbursed for all that you've been offering it for?
Yeah, that would be a question for the Department of Human Services. They will pay for the time at which the approval through them is finished, because they have their own requirements. And so you would have to contact Direct Pay Unit for that question.
Okay, thank you.
You're welcome.
And then Jordan, did you want to ask your question around opening alongside school districts?
Yeah, thank you. I just had a question. We're a non-recorded program working with kids mostly 12 and over. And you talked about guidance coming out in about a week and a half. Our district actually starts school next Tuesday. Is there anything we can operate in the meantime? You know, like a gathering rules, kind of summer camp rules? Just for us, it's hard to wait because we already have parents asking about what services we can provide.
Yeah, so I would say in that case, following at least the day camp, the summer camp guidance. I would caveat that and say, because it was only intended for the summer, I mean, that you're still limited to cohorts of 10 under that model, the summer camp model. So that's the limitation there. And so, but that's sort of the guidance that's in place for the broader age range. That also would align with the limited in-person instruction guidance that's in Ready School Safe Learners. So I would start there, and then as we continue conversations with the Oregon Health Authority, I'm happy to send updates to Bethany to share with this group about any changes that we see happening.
Thank you. That'd be great. Anything for the kids outside of childcare would be great. It's been hard to find things, but thank you for that. I'll keep an eye out.
Yeah, absolutely.
And then I had another question that's really into the more minute of what is in the guidance around, can parents do pick up and drop off inside of a building, or does it have to be outside? I know there's great discussion on having parents line up outside or wait and come in one at a time.
Yeah, the guidance does require that it occur outside. And you certainly don't want parents in a big long line. So you'll want to establish some sort of a system where drop off is staggered, or people stay in their car and staff go to their car to greet the child, but you don't, they are required to do it outside, and you don't want to just stack parents up standing in line, because that's going to totally defeat the purpose of not having parents entering the program.
And then Eric just wanted to clarify if continuing to follow summertime day camp guidance for school age programs that are not child care post September 1st, if the district is not operating, or if there's not. So because what you said with Jordan's question is they mostly work with over 12-year-olds, so the child care guidance wouldn't be the best fit. So just wanting if there's any way to get a like semi-firm, if you operate under, if you're continuing to offer camps, then you can continue to use camp until the district starts, or is there any way, I mean, that we don't want to disrupt service is what Alyssa said, but we also don't want people to get fined for offering care. Yeah, and Shira or Alana, if there's anything you want to add from OHA's perspective. If a program is just trying to continue until the school year starts, whether that's comprehensive distance learning or any other model, they should continue to follow the camp guidance if they've been a camp. If they're a new program that's starting and you're caring for kids outside of that 6-week to age 12 range, I would say that looking at the camp guidance is probably the best bet. But Shira or Alana, is there anything else that you would want these programs to reference from the broader set of guidance OHA has put out?
I don't think so. This is Shira. I don't think so, as long as they're following the school age summertime day camp guidance that captures the face covering, statewide face covering requirements and other requirements around gathering sizes. So I think I would recommend that for now. But again, we're going to be continuing conversations around these different types of programs for those age groups in the next couple of weeks.
And thank you. And then there are still recreation sport guidelines and other guidelines that people would use for camps or sports.
So for school sports teams that are practicing or training or competing in some non-contact or minimal medium contact sports, if their schools are distance learning, you can see kind of the different requirements in the K through 12 statewide school sports guidance that's posted on our website. So we would refer folks to that if it's a school sports team. And then for recreational sports, we still have our phase 2 rec sports guidance that's posted, and folks can use that as a reference as well. But we are still continuing conversations around looking at recreational sports statewide and other things like that for the future. So we will inform this group if more comes on that.
Thank you. And a question around outdoor programming, and this actually came up numerous times. So with the research that outdoor spaces tend to be better for not spreading the virus, but if programs are offering completely outdoor opportunities, is there any guidance or recognition that those might look any different? Or is it simply within the guidance that if you're outdoors, you don't have to wear a mask within 6 feet? Is that the only change?
Shira or Alana jump in here, but at this time, we don't have any guidance that's specific for programs that are solely run outdoors, aside from the requirement that they still have to wear masks. And Shira, if there's anything you'd want to add to that as well.
Yeah, I would say, as it's stated in the summer camp guidance, that acknowledges both indoor and outdoor activities and events. If it's a park, if it's a program at like a outdoor recreation organization, so like a park or something like that under the city or park district, there's the outdoor rec guidance that talks about, you know, statewide face covering requirements when you're outdoors and gathering size limits. So there are a couple of different options there for different types of outdoor programming. But yes, the main one would be most likely the requirement to wear face coverings if you can't maintain 6 feet of distance between other people when outdoors in a public space.
And then to the face covering question, there's actually mention in the new guidance Karen says here around social distancing is not required within stable cohorts. Can you expand on that?
Which guidance are they referring to?
Is that, Karen, is that the child care and early education guidance, new one on for September 1st?
So I think I can talk a little bit about that if it's talking about the childcare guidance. You know, originally when this all started, there was this idea of putting in about physical distancing in the documents for early learning division, but we really know that young children can't actually physically distance themselves when they're playing. And so that really is not required within a stable. It's required that stable groups aren't mixing and that teachers in one stable group are then not having close contact with children and teachers in another stable group. But within that group, we completely acknowledge and understand that young children are going to be near each other. And you just want to do the best you can to provide activities that will support that distancing, but realizing that 3-year-olds are going to get near each other, and that's just the way it is. Or even 8-year-olds, you do the best you can.
And then to the point that 8-year-olds would be wearing face coverings most likely to also help with that factor. So.
Right.
And then there was a question around if there's other local supports, and then Toby put in, can you share child care resource and referral contact information for programs needing assistance applying for ECC? So if you do not know what child care resource and referral is, or you do not have contact with them, we can share the link here so that you can find your local agency and contact that would be able to also help in case the Office of Child Care happens to be busy during this busy season.
And they can also guide parents around the ERDC.
And then I did want to know, Kathy, I did see your question on where weekends fall within this after this 8 hours or exemptions or what, if you're offering weekend opportunities, is there an assumption that you would go under 8 hours? Or if you happen to go over 8 hours for your classes, do you have to be emergency childcare if you're providing place a parent for 8 hours or more?
So the 8 hours a week includes weekends. It's not that you get 8 hours Monday through Friday and then the weekends are free time.
And Kathy, sorry, go ahead and unmute if you had follow-up to that to just clarify.
I'm getting really confused. I thought we just clarified if we were operating a camp that had already been posted and we did our summer camps and where fall camps haven't happened yet, but they're scheduled for on, let's say, over a period of a Saturday and a Sunday for 9 hours. I thought we already clarified we're still operating under summer camp guidance.
Okay, I didn't realize that the question was related to a summer camp program. I thought it was just the 8-hour-a-week exemption. So Alyssa can more address that.
So these are camps we rescheduled to spread out our camps over an extended period of time because so much more was required. So we took them from the summer, moved them to weekends in October and November. Are we saying that we're continuing our summer camp program and we're still operating under those guidance?
So if you're planning to operate basically through the fall, I would say over the next couple of weeks, you can follow camp guidance, but especially if you have kids 12 and under, you should be preparing to be emergency childcare. Where we talked about continuing following the camp guidance is if you're really just trying to bridge this gap for delayed school reopening. So if you're planning on kind of going through the first or second week of September, keep with camp guidance. If these programs are planning to operate well into the fall, into November, you should start the emergency childcare process if you're caring for kids under the age of 12.
So maybe Eric can pipe in here because he's asking for more than just our program at OSU. And I guess the other question is, at OSU, we're a government agency. So in the beginning, somebody said that we're an exemption. Is that correct?
Your government entity, you're exempt. So there's still the expectation, however, that you're following the child care guidelines if you're caring for kids under the age of 12.
But we don't have to apply for a separate certification?
Correct.
Okay.
And then Eric brings up the fact that while summer camps, as we've discovered this summer, are a huge entity, they're actually camps themselves operate throughout the year. And I just think some recognition. Eric, you're welcome to chime in if you'd like, but I think
that's it. I mean, it's just that summer is a season, but summer is not synonymous with camps. Camps happen throughout the year, and they're not childcare, although they may exceed 8 hours. So there seems to be a discrepancy there. Summer and camp are not the same thing. Summer is a time frame. Camp is a mode of, it's a program design.
Yeah, and we'll follow up with the Environmental Public Health Office and OHA that licenses organizational camps. They're involved in these conversations as well. Again, this is not red tape for red tape. This is about public health and safety, and especially because so many schools are canceled and we do have so many ways that programs are stepping up to meet the needs of kids and families. We just have to have that public health and safety through line. And and making sure that none of these spaces become a place where we see major outbreaks. So we'll follow up with Gabriella as well to make sure she's looped in and that this is consistent across the board.
Sure. And the only thing I would add, this is editorializing, is that, I guess I'm not aware if there's been major outbreaks in camps over the summer months. So it'd be interesting to know if there's, certainly the public health concern is utmost for all of us, and want to make sure that programs that are not, modifying their programs, as in they're not changing to, full day programs where they previously were only operating, Saturday afternoon day camp type programs or something like that, that those aren't, prevented from happening, because that's going to exacerbate the issue and the challenges for families.
Absolutely. Shira, correct me if I'm wrong. I know we had at least one camp that met the threshold of a reported outbreak and was disclosed by the Oregon Health Authority over the summer. But yeah, appreciate the nuance, and we'll keep talking with EPH to make sure that we're just being consistent across organizational camps and childcare and recorded programs and all the different gray areas we've created with our statutes.
Yeah, thank you.
And there was a clarifying question from Matt around, can all-day programs occur during students' online distance learning time? And I guess my question or response to that is they can, and if it's how well you incorporate the distance learning component. If you choose to, and parents choose, like that you're not causing youth to not participate in distance learning. Is there a different piece of that that we're missing, Matt, that we want to make sure we address? Matt,
no, I just wanted to clarify it because I know a number of us are doing it, and I heard some question about talking with ODE about some of those issues from Alyssa, I think. So I just wanted to clarify that because I know there's a number of us that are planning on doing all-day programs that do support distance learning as a part of the program.
And Tami can jump in on the nuance here, but we don't want programs to not be able to support comprehensive distance learning. The distinction that Tami can speak more to is if you're providing that support during school hours, you can't do that as a recorded program. So this again gets you back into, you have to get that emergency childcare approval and work towards licensure.
Yeah, correct.
Yeah, or in our case, we're a governmental agency, so I guess that doesn't apply, but it could to others. Thank you for clarifying that.
Absolutely. And if you're caring for kids under the age of 12, you should be following the child care and early education guidance in terms of group sizes and things like that.
Yeah, absolutely. I don't think any of us have questions on that.
Yep, perfect.
And Karen's got a great question here on, will ODE or anyone else be offering guidance for childcare facilities on assisting with distance learning? And I don't think we have an ODE person here, but Alyssa, do you want to?
No, it's a great question. And Tami, feel free to jump in too with what Office of Child Care is working on. But we're having conversations almost daily with the Department of Education and the Early Learning Division to talk about where kids are in the day since they won't be at school, and trying to get those supports, whether it's access to Wi-Fi technology, setting up spaces. I've talked, I know, with a lot of, license exempt providers, for example, who never had to support kids in school, and you've got 5 different ages between your kids and the kids you're watching, right? So definitely a lot of conversation happening with the Department of Education around how we can support comprehensive distance learning in these settings. I know that there has been some information the Early Learning Division put out to support preschool promise providers who may not have been reconvening and supporting some distance learning from that perspective, but we are working to determine how to help providers, Boys and Girls Clubs, other programs who are trying to help kids through comprehensive distance learning.
Thanks. And then there was a question around if a parent is with their child and you're offering, this said opening up the church to offer Wi-Fi for distance learning support. But if a parent is with the child, is there any other licensure or requirement besides following health and safety practices that they would have to worry about?
So it gets a little tricky. And Alyssa, if you have anything to add, drop-in childcare, such as in a health club, is right now not allowed because of the stable group requirements. And so if a church wanted to open up and the parent were there, that would not be childcare. And it is exempt, but the exemption that we use is the same one that we would use for the health club, where the parent remains on site. So that's where it gets a little bit difficult to parse it out. Alyssa, do you have any thoughts on that?
No, I think it's a good question. And Shira or Alana jump in. To me, that's akin to somebody jumping into a Starbucks and using their Wi-Fi. And, at this time we're not trying to regulate those spaces.
I agree.
So I don't think there would be any expectations there aside from following the health and safety guidelines for being in public spaces. So wearing your face covering, maintaining physical distance. Shira or Alana, is there anything else that you would think needs to be considered with that?
Hey, this is Alana. No, I think that covers it. But again, I think, as you said, Alyssa, numerous times, we're kind of continuing to talk about it, but I don't think that there's anything else that we can add to that comment at the moment. Thanks.
Thanks.
And I have one other question I'd love to squeeze in here, probably among others, but if a government agency is able to run the all-day support program for comprehensive distance learning following the guidance, can a private school do the same? So
private schools do not have an exemption like a government agency does. And so private schools are required to follow licensing rules if they're conducting childcare. Whereas a Parks and Rec, because it is another government agency, they do have an exemption.
And I know that I'm sure that we've missed many questions. It is, just to the end of our time barely, but is there anyone that wants to unmute for one last additional question? There was a couple on timelines, so when to expect things, particularly for older youth and camps, and I know you said hopefully by the end of next week for this, I think, and then other templates coming within another week or so that we'll happily share out with everyone on the call, but anything else that we need to follow up on?
Could I just do a follow-up on my question?
Mm-hmm.
Yeah, so if a school is doing over 12-year-old students, then the early childhood guidance would not apply?
Yes.
So a school with, say, high school kids could do all-day support for distance learning in the school?
So I would say, and I will confirm this with the Department of Education, schools, whether they're private schools or public schools, still have to follow the Ready School Safe Learners guidance when bringing kids back to campus. So you would still be limited to the limited in-person instruction with cohorts of 10 and the 250 children in a facility. If you meet the criteria to reopen K-3 or others, then continuing to follow the Ready School Safe Learners guidance on school grounds.
I'm sorry, can I just clarify? So a Park and Rec can run an all-day program for high school kids, but a private school could not run an all-day program for high school kids?
A Park and Rec we're working on developing what the guidelines would be, but I think it's safe to say that there would not be an allowability to bring back, 40 kids in one room together. So while we're working on what the guidelines are, there will be expectations even for government entities to make sure that we've got physical distancing, face coverings, and group sizes in place.
Right, so if they were in stable cohorts of 10, they could be on campus to get support for comprehensive distance learning all day then?
At a government entity currently, yes. For schools, the limitation is currently 2 hours.
So I guess I'm confused a little bit. What would be the difference between a Park and Rec doing stable cohorts of 10 all day and a private school doing cohorts of 10 all day? Why would that be different?
Yep. Shira or Alana, is there anything you want to add there from the conversations you've had with the senior health advisors?
Hey, this is Alana. We actually haven't revisited that with them again since we had that conversation, but we can certainly follow up with you about that, Alyssa.
Thanks.
Sorry, how would I get that information?
I will circle back with Bethany when I get back from vacation next week on where conversations are. And I think our commitment is by the end of next week to be able to indicate that there will be guidance coming out, or you need to look at this existing guidance when you're serving children over the age of 12 in settings. So we may not have the detailed guidance ready, but we should at least be able to get back to Bethany and you all to say, yes, there will be guidance, or we're going to be turning you to a version of childcare education or Ready School Safe Learners or something else.
Great, thank you very much.
Yeah.
I have an additional question also regarding a private school situation, if I may.
Yes, I'll do my best.
Okay, thank you so much. I am a teacher at a private school in the Medford, Oregon area, and we are in process for applying for full licensure. as well as the ECC on our campus. And we've submitted everything and we're just waiting right now. But we're hoping to do we've applied also, we have put in our operational blueprint with ODE, and we are going to have the small cohorts of limited in-person learning in the mornings. We are wondering about operating our childcare center in the afternoons. We're working with our licensing specialist. Is there anything we should keep in mind other than just what she is directing us to do right now?
Yeah, Tami, is there anything you would suggest with licensing in mind?
Yeah, I mean, this has not been easy. Let's just say having the school shut down and then private schools are coming to us saying, well, license us for all day. And our answer to that is we can license you. If you meet the requirements for childcare licensing, we can license you. But the program that you offer has to be childcare and not instruction disguised as childcare. So, we'll license you for the afternoon and the program has to look like childcare. And as long as you're providing childcare in the afternoon, you are allowed to do that and to get a childcare license.
That's very helpful because really there's a huge need for the childcare in the afternoon. So that's what we're trying to meet that need.
Yeah.
Thank you so much.
You're welcome.
Thank you so much, Alyssa, Tami, Alana, Shira, for all of your best efforts at getting through as many questions as possible on a very sometimes confusing and layered topic. I hope that we provided a little bit of help for programs on where to go and what to follow, knowing that it is our best intention to provide safe spaces for youth. But to add the editorial comment that we know that there is going to be huge gaps in access and opportunity and services for so many youth and families this fall. So as we're all doing our best, let's keep that at heart and at mind. And if there's anything we can do to help expedite any process in getting feedback or anything implemented, please let us know. I'll make sure to share out everything with the registered participants and continue to pass us questions if you aren't getting and you don't know where to go. So we'll help the best. Else?
Bethany, thanks for bringing us together for this discussion.
And Bethany, I know you were recording it. Is it possible to have access to that recording? Because I know this recording could also support my staff with their understanding too, as they're trying to support programs.
Yes, we will have it uploaded and online, and I will send it out hopefully later this afternoon.
Wonderful, thank you.
Yes. And for all the questions we didn't get to, we will do our best to follow up and send out that information. And thank you for everyone who filled out our survey. We'll make sure to share back. So we wanted to capture some of the difference of what's going on. So we'll make sure to share back with everyone on the call as well what we've found. And thank you, everyone. Have a great afternoon.
Thank you.